The American Hospital Association's strategic alliance with Unidos US, the nation's largest Hispanic advocacy organization, brings both organizations together to improve the health of communities across the nation and increase diversity among healthcare leaders shaping the future of care. The Healthy, Equitable, and Resilient Communities Initiative, a joint effort to highlight AHA member hospitals and Unidos US affiliates working together to respond to challenges of disparities, violence, and trauma, is an example of one such effort to advance health equity. This podcast series will explore the Chicago community and how healthcare leaders are looking to community leaders to collectively address key health challenges. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hetterly, Senior Writer at AHA and your podcast host. In this podcast, Breaking Down Mental Health, Disparities, and Access to Mental Health, we will learn about St. Anthony's Hospital-led Collaborative for Community Wellness, a Chicago-based collaborative comprised of 22 community-based organizations. Our speakers today will share how healthcare and community leaders can work together to improve health and health access in communities. Dr. Arturo Carrillo is currently the Manager for Mental Health and Family Support at the Community Wellness Program at St. Anthony's Hospital, serving the southwest side of Chicago. The Community Wellness Program provides free wraparound social supports in the areas of mental health, parenting and childhood development, health, and access to public benefits. Dr. Carrillo helps lead the Collaborative for Community Wellness. Also with the Collaborative for Community Wellness is Executive Director of Brighton Park Neighborhood Council, Patrick Brosnan. BPNC works in 6 core issues areas: health equity, immigrant rights, education justice, violence prevention, housing equity and foreclosure prevention, and economic justice. BPNC is an Unidos US affiliate. Thank you both for joining us. Dr. Carrillo, please provide an overview of the Collaborative for Community Wellness and how the work of CCW has signaled the significant disparities in access to mental health in Chicago communities.
Sure. Well, thank you for having us. I'll begin by talking about the Collaborative for Community Wellness as an outgrowth of what has been the Community Wellness Program for St. Anthony Hospital. I was fortunate enough as an intern all these years ago to walk into a space where we were able to offer free counseling services as a preventative model to address social and economic issues that people were dealing with in the community of Little Village. Part of what we were able to do is offer free long-term trauma-focused counseling services, again, to people who wouldn't have access otherwise. And so, that was, to me, as a licensed clinical social worker, an amazing space to be trained as a clinician, but also as a practitioner, a space that was very unique in the way that we were able to break barriers and offer this type of resources to people in the community free of charge. And so I was able to enter that space, learn a lot. And one of the things that was really, really always striking to me was the fact that we always had a waiting list for mental health services. And that went counter narrative to what I was hearing in the classroom, right? So I'd be in the classroom in our social work class, and they'd be talking about stigma and the barriers that Latinos face with accessing mental health, and stigma seemed to be the main focus. Then I'd go to my practice, to my practicum, and I would see that that was not the case. We had an overwhelming demand for services. Nonetheless, I continued as a provider to work there for years. After I graduated, I was offered a position, so I stayed on as a provider. And the constant was always the waiting list. We always had a waiting list for services. So, of course, being a social worker, I also have a very strong inclination to work with community partners, to engage with community organizations that are doing organizing, that are really addressing what social issues are impacting the community. So within that, we were able to develop partnerships with different community organizations, establish one form of collaborative or another to address some of the issues. And mental health was always the issue area I was very focused on. So through the years, we grew in partnerships with many organizations. We were able to grow across communities to talk about the issues of mental health that were impacting community residents, because although we had a center and we continue to have a resource center in Little Village, we would have people from all parts of the city come to access our mental health services. They would drive or commute to access our services because, again, there was such a need and our waiting list was a constant. So within that, we would meet with community organizations across the city on the southwest side specifically. And those community organizations would all say the same thing. There's such a need for mental health services in my community, in my neighborhood. And so through that, we really started thinking about how can we best coordinate to address what these issues are, right? These are real systemic issues that are leading to people to really desperately seek mental health services where services do not exist. And so with that, the Collaborative for Community Wellness was an outgrowth of many collaboratives that we were part of, and really set to bring all the partners together under one umbrella, the Collaborative for Community Wellness, as a unified voice, speaking to what are the issues and trying to really document what are the social barriers and economic barriers to accessing mental health services. And so I'm very proud of the work we've done together. I was also throughout that entire time embedded within a PhD program. And so bringing and being able to take a research lens into our work both as practitioners, being mental health providers, and as community organizations, assessing mental health needs within their own communities. We were able to really kind of share our wealth of knowledge and, again, be able to develop a research project that asks community residents themselves, what is it that you see are the needs for mental health services, both personally, your desire to access services, and what are the barriers to care? And so with that, it was an amazing collaborative with various organizations. And within that, we were able to collect 3,000 surveys across the southwest side of Chicago. And our findings really were able to tell much about what are the issues that people are facing on the ground.
Patrick, as a community leader and member, please share the importance of collaboration to improve the health of those you serve.
Thank you. Absolutely. It is so instrumental, the partnerships that we've been able to develop through the Collaborative for Community Wellness. And I think one of the things that is really important in terms of our approach has been recognizing how all of these issues in the community intersect and overlap. And so when we're addressing issues around mental health, because we're approaching this work in a trauma-informed way, we really understand the impact of trauma, the impact of people living in poverty, the impact of people living in a community where there's a lot of street violence or there's a lot of domestic violence, and how all those things impact the mental health of the community as a whole. And so we're working on policy change with our healthcare providers. We're working on citywide or countywide policy change, but also policy changes within the hospital systems themselves. So how can they address these intersecting needs that the community has? And how do we, as a community organization, how do we continue to provide proof and provide the kind of data and resources and access that they have to community residents themselves, so they can learn more about how they can be more effective at impacting the healthcare needs of the community? So this has been a profoundly interesting and great opportunity for community leaders, for moms and dads in the neighborhood, people who usually aren't engaged in conversations with healthcare providers other than like, I'm sick and I'm seeing my primary care physician or something like that, or a nurse, but really starting to talk to people who are in positions of authority at the hospital to make decisions about how these types of organizations provide care in the community.
Dr. Carrillo, your experience speaks to the importance of assessing community health needs and identifying and addressing health disparities through partnerships. What are some of the key takeaways you would share with other health leaders?
Absolutely. So, this has been crucial. I think for us, this project, as a hospital has been an effort that was very intentional to build on what we kind of already saw in our community health needs assessment that we do on a 3-year basis. Mental health has always been a priority. Like I said, the St. Anthony Hospital has invested in the Community Wellness Program that offers free social services in the community embedded within various community resource centers across communities on Chicago's west and southwest side. That has been a very intentional effort by St. Anthony Hospital to create essentially an entire department that's fully funded by hospital operations to offer free services because of just how important preventative access to services are for community residents. And an issue of mental health, we know that there's so many barriers to accessing. So I guess for hospital leaders, it's very important to understand that the voice of the community residents is very important, but also not to lead them on, not to come in to assess what the social needs are for the sake of assessing what the social needs are, but to very much intentionally invest your resources as a way of meaningfully activating partnerships where you as a hospital with resources that you have, financial resources you have access to really invest in filling those gaps, right? Because as our research showed, the city of Chicago has many gaps when it comes to mental health access. And the only way we could sustain a collaborative like this is by also partnering with our member organizations and bringing therapists to their work. We have at this point 8 licensed clinicians that are embedded within the organizations that are part of this partnership, or we have some very direct intentional partnerships and referrals networks that we've established to make sure that we're sharing not only resources, but being able to coordinate on service delivery to community residents who really need this.
Patrick, what are some of the barriers you and your community have overcome, and how are healthcare leaders part of the solution?
So the Brighton Park Neighborhood Council, several years ago, in partnership with United Way of Metropolitan Chicago and other funders, helped to develop the Brighton Park Neighborhood Network, which is a coalition of over 40 different providers. And one of the really key issues that the Neighborhood Network endeavored to address was improving the coordination between all the healthcare providers, in addition to increasing resources on the ground. Mental health care, but also primary health care. We know we need to increase the health infrastructure, so not only increasing the health knowledge of people on the ground, but also actually the bricks and mortars and trying to get more resources in the community. And so we formed a committee that includes almost all of the healthcare providers that are working in Brighton Park, that are providing any kind of care to Brighton Park residents. And they participate every 2 months in meetings and strategic sessions where we're thinking, about what are the resources that they're providing and how can we best collaborate and coordinate these resources to have the most effective service delivery model as possible. And we've had some tremendous success. So St. Anthony Hospital has really dramatically expanded the investment that they've made in the community in terms of primary health care and also outpatient mental health care. We worked with UIC to build a school-based health center. That's a federally qualified health center, expanded through their model, their network. Access has really expanded its service delivery. So we've seen some tremendous success in terms of really increasing the kinds of health investments that are important. And then also, we've been able to, with support of Unidos US and some other funders, expand a promotoras program, Promotoras de Salud, where they're actually where we have 8 promotoras working in the community, organizing healthcare education seminars, bringing in experts to address a host of different issues, healthcare issues that people want to learn about. They want to learn about women's health issues. They want to learn about cancer. They want to learn about diabetes, mental health, all sorts of different issues that are important to people in their real lives, and they want to increase their health education, their health IQ. And so we've been able to do this through partnership by weaving together different resources and bringing together as many institutions as we possibly can.
Thank you for listening, and thanks to Dr. Carrillo and Patrick for sharing key insights and learnings from their great work on advancing health in America. If you want to learn more about the work that the AHA is doing with Unidos US to advance health equity, visit us at www.aha.org/alliances. I'm Tom Hetterly, and this has been Advancing Health, a podcast brought to you by the American Hospital Association.